Alphaviruses represent a group of mosquito-borne viruses that can cause a range of illnesses, from mild fever to severe neurological diseases. Infected individuals might experience symptoms such as fever, joint pain, and rash, with more serious infections leading to encephalitis or meningitis. In some cases, people may develop chronic arthralgia, which is persistent joint pain that can linger for months or even years. While there is no specific treatment for alphavirus infections, management typically revolves around symptom relief, such as medication for pain and fever, and supportive care for severe cases. Individuals living in or traveling to regions where mosquito-borne diseases are prevalent are at a higher risk of contracting alphaviruses, with prevention largely focusing on mosquito control and personal protection measures. To further understand these viral infections, let's delve into the detailed aspects of alphaviruses. Symptoms and progression of alphaviruses. Alphaviruses, a group of arboviruses transmitted primarily by mosquitoes, manifest in patients with symptoms ranging from fever, rash, and arthralgia to severe neurological complications. The progression of these viruses can be rapid, with initial flu-like symptoms evolving within days to more severe and potentially chronic joint pain, which can be debilitating for some individuals. Neuroinvasive alphaviruses, such as Eastern equine encephalitis virus, can lead to encephalitis with a high mortality rate. Survivors may have long-term neurological sequelae. Understanding the symptomatology and progression of alphaviruses is crucial in anticipating patient needs, managing expectations, and developing therapeutics. Diagnosis of alphaviruses. Alphaviruses, a group of mosquito-borne viruses, pose diagnostic challenges due to their nonspecific initial symptoms, such as fever, rash, and arthralgia, which mimic other febrile illnesses. Diagnosis often hinges on serological testing, where the detection of alphavirus-specific antibodies using ELISA, enzyme-linked immunosorbent assay, tests can confirm exposure. Molecular techniques like RT-PCR, reverse transcription polymerase chain reaction, have become indispensable for identifying viral RNA in early infection stages, offering higher sensitivity. Rapid and accurate diagnosis is critical for patient management and controlling outbreaks, especially considering the potential severity of alphaviral diseases, such as chikungunya or Eastern equine encephalitis, which can lead to long-term complications or even fatality. Cause and risk factor of alphaviruses. Alphaviruses are arthropod-borne viruses, typically spread through the bites of infected mosquitoes, such as the Aedes or Culex species. This mode of transmission identifies regions with high mosquito populations as high-risk areas, especially where standing water provides breeding grounds. Climate change has expanded the geographical range of these vectors, increasing the risk of alphavirus spread. Furthermore, genetic variations in the virus can affect its virulence and the immune response in different populations, which can lead to variations in disease severity. Human activities such as deforestation and urbanization disrupt natural habitats, potentially increasing contact between mosquitoes and people, hence raising the risk of transmission. Additionally, lack of vaccines or specific treatments for most alphaviruses underscores the importance of understanding these risk factors to prevent outbreaks. Treatment and management of alphaviruses. Alphaviruses, a group of RNA viruses, including chikungunya and Eastern equine encephalitis, pose a significant challenge for treatment and management, primarily due to the lack of specific antivirals and vaccines. Management typically focuses on symptomatic relief, such as administering analgesics to alleviate pain, antipyretics for fever, and fluids to prevent dehydration. In severe cases, hospitalization might be necessary to manage complications like encephalitis. On the preventive side, controlling mosquito populations and avoiding bites through repellents and nets are key, as these are the primary vectors. Research is ongoing to develop targeted therapies and vaccines, which is crucial to combat these infections effectively. This includes exploring broad-spectrum antivirals and understanding immune response mechanisms to inform vaccine design.